My name is Ken Mishark. I am a physician and I have worked as an inpatient physician for 27 years. So my career originally started as an outpatient primary care doctor, and I was both in the clinic and the hospital, and I realized that it's hard to split yourself among both. So I became an inpatient doctor 27 years ago where I work with nurses every day. And what I've realized is doctors set the courses and nurses carry through the plan. The nurses are my eyes, my ears, my brain, and literally lifesavers. 30 years ago, nurses were very task oriented. So, what that means is they would do things without really thinking and understanding why. And as things got more complicated, it didn't work. And what's happened is nurses have taken a much more active role in understanding and helping shape the plans for patients' care. So the phrase that's often used is practicing at the top of their license, which is dramatically different than years gone by where they would do something without asking why. The nurses bring comfort, they bring a layer of safety, and they bring the hands-on care. They're the first people you're going to meet at birth and probably the last ones you're going to see at the end of your life. And they are the hands of healing, the hands of healthcare. So, what I want the public to know is a little more about healthcare in general. Marcus Welby was what a lot of people grew up with, where one physician did everything, knew everything, and took care of everything. Modern healthcare is much more complicated than that. And it's a team sport, and the team is physicians, the team is advanced level providers, the team is nurses, the team is therapists, the team is the person that answers the phone. And the part that we have in common is we have to be able to care for people, we have to be able to talk to people, we have to be able to communicate with people. The part that we don't have in common is the tasks that fall to each member of the team. As a physician, my job is to diagnose and try to outline a plan. The nurse's job is to implement the plan and watch for things going awry. And even the most basic functions, such as getting up and going to the toilet, falls to the nurses. The most intimate things that could happen to you are done by nurses. So, one of the things that's very important is having a safe hospital, safe healthcare delivery. And there's been many, many studies trying to decide what's safe. Is it the doctor? Is it the nurse? And the one thing that comes clear from all of those studies is that the nurse to patient ratio directly affects quality of the hospital and survival of the patient. The fewer patients per nurse, the better that patient's going to do. It allows them to do the hands-on care. It allows them to be the eyes and the ears of the doctor, and it allows them really to timely communicate when things aren't going to plan. A second set of eyes and ears are really critical. And from the standpoint of being a patient, what we want is somebody there to hear, to listen, to process. And the problem that a lot of doctors have is we think we're communicating, but maybe we're not getting our message across. Too much jargon, too much using words like neoplasm rather than cancer. And the advantage of a trained observer being there is that second set of eyes and ears, which will save a lot of misperceptions and result in overall better care, calmer patient, better educated patient. It's no secret that people are getting sicker and sicker and leaving the hospital when they're sicker and sicker. The transition to home is the most critical part of healthcare, and quite honestly, where things go wrong the most. Having a trained nurse to be able to come in, smooth that transition, find things that weren't done correctly is really money well spent and helps the patient heal and provides comfort that is very important to the healing journey. Home health care is a number of different things. And as background, Home health care can be a nurse coming into your home. It can be a therapist coming into your home. And the problem is the reimbursement isn't great, and those nurses are very pushed for time. They're also heavily regulated, so my perception, right or wrongly, is most of their time is spent doing paperwork. Much of it is not taking care of the patient. An organization that provides a nurse that's paid for by the person is much more focused on the person and will do a better job for the person. So people are leaving the hospital sicker and sicker, and that is because hospital beds are at more of a premium. Payers want people out of the hospital. In that transition, it's by far the most dangerous time, and there's gaps in care that can occur. Even though we set up home health care, it's not unusual where the home health care gets pushed back by a week or two. And by that time, all the bad things going to happen have probably happened. Having somebody come in dedicated to that one person rather than a whole list of people in that important transition makes a huge difference. Americans are very set on having a lot of things, and things don't buy happiness. Having a nurse who can help you with the transition, provide you comfort, make sure things go smoothly is worth its weight in gold. Healthcare is a team, and a very important part of that team is the nurses. They are the eyes, the ears, and they are the first people to say, this isn't going the way it should. They are the boots on the ground, and they are the trained observers who can tell you when something's not going right. The most obvious and granular thing is when I do discharge medicines, I would say to somebody, so I want you to take 50 milligrams of this pill. And people often aren't literate enough to realize what 50 milligrams of a pill is. So overdosing or underdosing medicines is incredibly common. The other thing that's really common is the mentality of, I paid for this medicine, I'm going to finish it no matter what. And it may be the reason you were in the hospital. By God, I paid for it. I'm going to use it. We take care of a lot of people who have bad diseases, such as cancer. And when they're in the hospital, they can be very stoic, not wanting to say they're in pain. So there's times we can undershoot the pain because they're stoic. When they get home, a lot of the facade breaks, and having a trained observer say, boy, this pain is much worse, allows us to treat their pain, give them better quality of life, and prevent hospital readmissions. Healthcare is very complicated, and when we give people lists, it's very hard for some people to translate what's on the list into what they actually do. And something as simple as filling a pill box, getting rid of things that aren't needed, makes all the difference in the world. Whatever causes a readmission, it's viewed as preventable, and sometimes it is, sometimes it isn't. There's a lot of money and time spent on preventing readmissions. Poorly communicating a requirement for somebody to go home and stay home, the correct medicine list, making sure the pills match and they actually have the medicines is money well spent. So one of people's perceptions is that you can come in and hear everything the first time, understand everything the first time. The world isn't like that. We're giving you very complicated ideas and expecting you to absorb them. And there's a lot of people who feel like it would be shameful to say, I didn't understand, or it'd be insulting to say, I didn't understand. Being able to ask questions, have your questions answered in a way that you can understand them is worth its weight in gold. Nurses come in all forms and flavors. And 30 years ago, a nurse would be at the bedside and stay at the bedside. What's happened, which is not a bad thing, but nurses have many more opportunities. So they're moving on to other jobs that are not directly at the bedside. And what is left is a more inexperienced nursing pool that doesn't recognize things as well as a more experienced nurse. And like it or not, the years of service help you become a much better healthcare provider.
I actually never thought I'd become a nurse. That was, like, never my plan at all, and, when my grandmother was diagnosed with cancer.
I remember.
You remember?
Yes.
because this man was the one who I will never forget ever in my life. He was the one that caught her in the emergency room,
Yep.
and he knelt down at her bedside and held her hand and said, "Sophie," and gave her the news that her cancer had come back. And watching him with her inspired me so much to have a career in healthcare because your compassion was like everything. And it's now a blessing to like have been back and working with you in clinical practice and have you be part of like all of this that we're building.
All right, on camera.
I'm so grateful.
And I'm grateful you were there because Grandma was really sick. And one of the benefits is we allowed your grandma to have a peaceful passing.
Yeah.
And that was really important.
Thank you. Thank you for being a part of all of it and making it easier for my family and I to hear the hard news and to really start to work through putting together a plan that really respected her dignity and her wishes. So thank
A
you.
pleasure.
Oh,
I have one more thing I want to say for the camera too, with Jasmine here. So the birth of Navi Nurses isn't what a lot of people would expect. It really was meeting for coffee, meeting for snacks, talking about how to make healthcare better and what we could do. And those ideas are really what spun up and turned into Navi Nurses. And helping define healthcare, make it better. A big issue with nursing is burnout. Helping with that is really what this journey is all about. And that's why I'm happy to be along with it.
thank you. We're so happy to have you.
Yeah, the burnout part is something you should emphasize because it's just so important.
It's so important.
Yeah.
Yeah. So like all the people around me are like full circle, like in every single way. And I'm so grateful, like so grateful. So thank you. Really.
Yeah, no, I'm glad you took the idea and ran.
I know.
And
I know,
ran
right?
and ran and ran.
I'm still running. I'm still running,
Yeah.
but it's like happening. So thank
Right.
you.
And by the way, one day she will complete her dissertation.
I'm like dissertation, what is it? PhD year 9.
Yeah,
I have
no,
one more year to finish it.
that was literally right at the start. And this was a pleasant distraction from completing that.
Yeah, absolutely. Totally pleasant. Ugh,